Hi listeners, Jason here. We are excited to finally announce registrations for the biggest psych health and safety community event ever. The inaugural The Psych Health and Safety Conference will be held at the Sofitel Wentworth, Sydney, June 19 to 20, 2024 and offer concurrent virtual attendance. It'll feature live podcast recordings with OG researchers including Christina Maslach and Michael Leiter of Burnout fame, Psych Health and Safety USA podcast host I. David Daniels, Australian super experts including the likes of David Burrows, a special 10-year anniversary integrated approaches to workplace mental health panel with authors Tony Lamontagna, Angela Martin and Kat Page, hand-picked case studies from organisations doing it well, and a very special interview with plaintiff Zagi Kozarov by Catherine Dunlop on that High Court case which we previously covered on the podcast. This event will sell out. Get in quick to secure tickets at early bird prices for the 2-day conference, pre-conference masterclasses, and the VIP dinner. The first 200 in-person registrations also get a copy of her latest book, The Burnout Challenge, signed by Christina Maslach herself. Find out more and register at www.psychhealthandsafetyconference.com. Now, on to this episode.
From Flourish DX, this is the Psych Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
All right, thank you for joining the Psych Health and Safety Podcast Canada. My name is Ian Lewis, and I'm guest hosting for Kim McDonald. And I'm really pleased to have with me today Kevin Mooney. And Kevin and I are actually both in Regina, Saskatchewan, but we're about 3 kilometers apart for ease of recording. So thanks for joining me today, Kevin.
Oh, thanks for having me, Ian.
Yeah, so pleased to have you here. And we've known each other for quite a few years. I've been practicing here in Regina for 16, so we must know each other 14, 15 years?
Yeah, definitely. I've been working in safety for about 20 years, and you've been a big part of it in the different places I've worked at. So, yeah.
Yeah, well, thanks. Well, maybe give our listeners and our viewers a little bit of an idea of how you got into health and safety and where that winding career path has taken you.
Oh, for sure. So actually, my career started in law enforcement, and that's where I got kind of my first taste of health and safety. I was a traffic officer in Alberta, and that's where I got kind of exposed to the safety measures that are in the transportation industry, you know, everything from National Safety Code, carrier safety ratings, and, you know, transportation of dangerous goods, that sort of thing. And from there, you know, I kind of transitioned into a corporate manager of safety for a trucking company back here in Regina. And I worked there for a number of years and then kind of evolved, progressed in my career to, you know, working for one of the industry safety associations. And then I was working for one of the larger multinational agribusinesses, director of safety in a retail environment, and then currently in my role that I'm in today, so VP of Prevention and Employer Services with the Saskatchewan Workers Compensation Board.
Wow. Okay. So over that career, I'm guessing, was that maybe 7 or 8 different appointments or positions?
Yeah, about 5.
Okay.
Yeah.
Yeah, I don't want to picture you as a career hopper or anything like that, but
Yeah.
you've definitely been in touch with lots of different people along the way. And now in your current role, then, what's a little bit of what you do now?
Well, I'm the Vice President of Prevention, and so have leadership responsibilities for WorkSafe Saskatchewan, which is a large partnership that we hold with the Ministry of Labor Relations Workplace Safety. And so, you know, that's a joint kind of targeting initiative where we work with the enforcement agency to, I guess, target some employers that are driving some of the injury rates in the province. And we work collaboratively with them to help those employers improve their performance. On the employer services side, again, when a company registers with the WCB, they're going to go through that department. We classify them into, you know, industry group, look after kind of the premium rates for that and the rate setting. So it's a bit of the safety and the insurance side.
So I'm guessing in your, I guess with the experience that you have, as well as your current role, you've got your eyes looking at safety in a real variety of different industries and different contexts.
Absolutely. I think that's what drew me, I should say, to this current role is the impact that you can have. You're touching every industry in the province, and I love it. I'm passionate about safety, and so to be able to operate at this level has been a real blessing. And every day is a new challenge.
Well, no kidding. And over the years, as we've gotten to know each other, I've really appreciated your brain and how it seeks opportunities. And you're like, oh, what if we did this? What about
Right.
that? And I think some insights. And so I really wanted to sort of mine your brain today as it
Oh,
as it
okay.
speaks, to really kind of look at, what are the things that drive people and organizations to work safely and to implement safety systems and to do all the things for health and safety. And you've got your eye on, quite a wide variety of industries, and you're working with some people who, might have real motivation because they've got high injury rates and paying high premiums, but you're also seeing different insights. And so I know today's conversation is not necessarily representing the Saskatchewan Workers Compensation Board, but really just about, what do you sort of see out in the landscape?
Well, it's all over the map. I think if you look at Saskatchewan, the majority of our workplaces are small businesses, right? Probably
Hmm.
less than 20 employees. You got to keep that in mind.
Yeah.
And then we have some very large employers on the other end of the spectrum, right? And we only have so many resources. So we really look at the data, evidence-based decision making. We've had really good results in this province over the last 10 years, probably a 50% reduction in our total injury rate. But starting in 2018, right just before COVID, we started to see a plateau in the province. And so we had to come up with, okay, we need maybe a different approach to break through this injury plateau that we're seeing. And I don't think we're the only jurisdiction. I think you're seeing this across many parts of the globe. And we did a bunch of research and found that, refocusing your efforts on trying to understand the root causes of serious injuries and fatalities is really kind of the next evolution, kind of the next generation of prevention, which is going to help us break through that plateau. Yeah.
So the plateau is still occurring, or have you seen some adjustments and you're again seeing a reduction in injury rates?
Yeah, slow reduction, but yeah,
Yeah.
it's flatlined, but we had tremendous results, right? Like 53% in 10 years, you got those
Hmm.
diminishing returns after a while, right? Let's
Right.
face it. Um, but doing the research kind of refocused us. So we didn't even have a serious injury metric back in 2018. So that was our first thing. We developed that, and it really brought together kind of an eye-opening experience for us, because what we found is, you might have 20,000 injury claims registered with us each year,
Hmm.
but 2,400, roughly 10%, are serious injuries, but they account for 85% of the costs in the whole system.
Oh my.
So I think from the human side and the business case, it's all wrapped up into one, right? I think everyone can get on board to really dig into those 2,400 because it's going to benefit everyone, right? So
So what are those 2,400 serious injuries? Are they like what is a serious injury? Like how does it get classified as that?
well, we've got five different categories. First one would be a fatal claim.
Okay.
Second one would be a primary psychological injury. We actually incorporated mental health into our definition.
Hmm.
Third one would be, there's coding that we do in our registry office that identifies certain factors that would go over to labor relations workplace safety. So if it's an amputation, a loss of an eye, a head injury, a broken bone, there's kind of 13 little sub-elements there.
Okay. Yeah.
Fourth category would be permanent functional impairment of 10% or greater.
Okay.
So this is where somebody's lost permanently function, right?
Hmm.
Maybe. And then the fifth one would be a WCB claim with 50 days time loss or higher.
Hmm.
And so that between those five criteria, it identifies the pocket at 2,400.
Right. And so those 2,400, so roughly 10% of claims are driving claims costs, and they're responsible for probably the highest burden of disability then. Like these end up being the most seriously the injuries that affect people the most, probably.
Yep.
Yeah.
Yep, that's
Okay.
that's right. It's very strong focus on severity. Like when you think about it, if I was to put that into a narrative, every day in Saskatchewan, 50 people are injured at work.
Hmm.
6 people will be seriously injured that they'll never return to work.
Oh,
And every 10 days, somebody's killed at work.
oh,
And so that's putting it into a narrative daily concept, right? I think that's kind of the vision and the rallying call is let's go prevent that stuff, right?
right.
And trying to develop services around that. So
Okay, well, I think everyone can get behind that to say, wow, okay, every day, there are people injured and not returning to work. And
yeah,
what was it? We have a fatality every 10 days, did you say?
every 10 days, roughly about 30 a year in Saskatchewan. And some people might look at that and go, oh, that's 30 people is not too many, right? But one is too many. But if
Hmm.
I put it into context, we are twice as high than the US and 5 times as high as Europe. And so that makes me sit back and think, well, what are they doing? Right.
Right.
And some of these countries are older. It was kind of funny. I was over in Germany last year and I met with a bunch of folks around occupational disease and whatnot, just trying to
Yeah,
learn what they've done there. And we are talking about silica and they're like, oh yeah, that's a 250-year-old problem.
correct.
So they've been at it way longer than we've even been a country, right? So it's
Yeah.
like, what can you learn from them, right? So
Hmm.
yeah,
So you've got this great desire to learn. You're saying, hey, if we can find out the root cause of a lot of these serious injuries, then we're going to be able to start getting somewhere. That's your bet.
yeah. Then if we can get to the root cause, then we can start looking for promising practices across the globe where somebody has, like, I'm a firm believer that somebody has solved most of these problems somewhere, right?
Hmm.
And we need to get peers talking to peers and sharing how they did that,
Hmm.
and then putting tests of change in place and go deal with it, right? To
Right.
prevent reoccurrence. And, one example of where we had success, and well, I'll use violence because it's kind of related to psychological health and safety.
Hmm.
We've got a growing trend of violence in Saskatchewan and probably many parts of North America, whether you look at transit or you look at healthcare, that sort of
Hmm.
thing. So we kind of scoured the globe, and while we found Western Health in Australia has had a 82% or something reduction in violence in their healthcare settings.
Wow.
So it kind of got piqued my interest, right? Well, what are you doing, right? So we actually flew those folks to Saskatoon,
Okay.
and
What a
we
treat for
we
them.
yeah,
Did you
no,
bring them in the
actually,
winter?
no, no. We brought them in May, and we had
That's
beautiful
beautiful.
weather,
Yes.
which is actually winter for them. So they came here and they're like, oh, it's so warm. So it's like, oh,
Yeah.
cool. You know, but they came and talked to a number of healthcare leaders and shared their change management approach. And they were using a specialized tool to identify, behaviors that would be likely to turn into violent situations. So they can actually see violence before it starts, right? So they're treating kind of behaviors of concern as very much like a vital sign. If they're checking your blood pressure, they're also checking your behavior and they're measuring that. So it was very interesting, very intriguing, and they've had the results. So that's what I'm talking about is when you find a problem and then you look for someone that solved it, bring them together and talk and share.
Right. Okay. So you're sitting here, in some ways, not the regulator, but you're the insurer,
Right.
and you're tackling and trying to bring this to the attention of people who have crappy experience. They've got lots of injuries, high costs, et cetera, et cetera. And you're trying to bring to them best practices. So on one hand, it's like, okay, that's maybe you've got a fairly big hammer, so to speak, to try to implement change. But in your experience, as people are looking to implement safety programs and to take action to really change those factors that are identified at work as being a problem, whether it's silica dust, right? Like we should all know that. We should all know about asbestos. We should all know about, the risks that are there. But what really motivates people to take action then?
You know, I think sadly it comes down most of the time a major incident, right? Whether it's at their workplace or in their industry, or maybe they're seeing something on TV. That's been my experience. And I think we need to change the dialogue around that and show the importance of safety. And it's an investment when you're spending the proactive time up front. But I've been personally involved in two workplace fatalities throughout my career. and definitely saw the profound impact that had on, obviously the family and the coworkers, but even the community setting for that organization. And that's usually been the wake-up call. In similar lines of thought there, we've got the Priority Employer Program, which I think you alluded to earlier. That's kind of one of our targeting initiatives. I think sometimes when people find out that, oh, geez, I'm on this list, maybe it's time to implement some change, right? So that's been my experience, unfortunately. Yeah.
So it takes a major incident. And so some people who are accustomed to listening to this podcast are like, where are you going, Ian? This is the Psych Health and Safety Podcast. It's not the Occupational Health and Safety Podcast. Psychosocial factors and physical injury factors are inextricably linked. But I'm sort of wondering, and you alluded to it, like psychological injuries are serious injuries under your classification.
Yeah.
I certainly agree. I think there's probably some parallels to be made between when do people start paying attention to psychological health and safety to the degree that they're paying attention to physical safety at work. And
Right.
you mentioned that it takes a major incident to maybe grab people's attention. And I think we probably saw that, right? 8 to 10 years ago, there was first responder, public safety personnel, suicide really hit the public radar. People came back post-deployment from Afghanistan, a number of RCMP members and, sectors like that. They really raised the awareness of we should do something. And thankfully, there's been a ton of research and action directed towards that. So from a psychological health and safety perspective, um, where do you see people getting traction then? Are they waiting for a major incident or what gets people interested in that?
Oh, geez. I agree with you. I think when you look at health and safety, I think for the most part, it's been on the kind of the classical approach of injury prevention, the physical injury side, right?
Hmm.
And we've maybe whispered a little bit around wellness and mental health, and maybe we've done nothing around occupational disease, right? So I agree with you. We need to evolve the dialogue around health and safety, that we're looking at safety, wellness, and health, right? Is a holistic approach, right? And I don't know, I think the business case is out there for psych health and safety. I think it affects all of us. Like, we've all seen the stats on TV, 1 in 5 Canadians will be affected by mental health at some point in their life, which means that it's going to touch all of us. Maybe not in the workplace, but it could be a family member, a friend, you name it, right? And so I think the principles within the standard and around psychological health and safety, I think people can resonate with it. I think the issue people are having is going from theory to practice. And I think that's where the gap is currently, and where we can continue to put more effort in. And I think it's only because the standard is still new. Like, it just had its 10th birthday, I guess,
Yeah.
right?
Hmm.
But I think it took us a couple decades even to get a common understanding of what a safety management system is. So I think psych health and safety is going through the same growing pains, right?
So the same growing pains, I guess, in terms of people connecting the dots between exposure to, say, high job demands and low job control, long working hours, and then that translates into more cases of burnout, depression, early exit from the workforce, etc.
Yeah,
Those long effects could be years, decades in the making.
it could be, you know. Um, I think employers are looking for, like, how can I put this into practice, right? So, like, one approach for psych health and safety could be just to embed it into your entire HR cycle, right?
Hmm.
Like, what do you do when you're hiring somebody, onboarding, training, one-on-ones with their supervisor? That could be an approach, right?
Hmm.
Um, or maybe it's just as simple as building awareness and breaking down that stigma to start, right? Um, we've been testing an approach with some employers, and getting some feedback. We just ran a pilot with 4 construction companies to kind of walk through a 7-step roadmap with them as well. So we're still learning too, you know.
Hmm.
And I think what people want is the practical piece, and just I always keep that vision of a small employer in the back of my head. How do we make it work for a small company, you know, and then scale it from there? But
Right. Okay. So on one hand, like you say, employers get motivated towards safety by a real seminal, serious event. Fortunately for small employers, they shouldn't have a serious event very often.
that's right.
You know, an employer of, five or eight or 10,000 is going to have more serious events. Just there's more people. A small employer, not going to happen here. I don't think it's a big risk for us. And so there could be that sort of complacency. But then there's also the occupational disease side of thing that things develop over time.
Right.
So for the people that kind of put it off and say, well, probably not going to have a serious event, and oh, all this other stuff just develops over time. I don't know if we're really at risk. Like, how do you get people like that to get serious about it?
Well, it's you're talking about risk tolerance, right? And perception of risk. And I think that's one of our biggest challenges, right?
Yeah.
Is I know through my career, I've always had success tackling safety from a reactive point of view first to get people motivated. So versus doing a risk assessment, which is more kind of like maybe an academic exercise, right?
Okay.
But I've always started with the actual incident. This happened. We all know Joe. He was doing
Mhm.
this task. He hurt his back. Do a bit of root cause. Oh, geez, you know, we don't have a safety procedure, or safe work practice, or a program to deal with that. Let's go develop that. And then you build that buy-in at the same time while you're building your proactive system. I've always tackled it from a kind of a reactive standpoint,
Mhm.
um, right or wrong. But I think
Okay.
people want to deal with real incidents, right? But to your point, you're right. Like a small company might have a time loss injury, let alone a serious one, every 10 years.
Mhm.
So how do you motivate them to get engaged in this stuff? And I think that's where I think psych health and safety relates with everyone because maybe we all know somebody that's maybe struggled with mental health, or maybe, for example, my son's football team. We had two suicides, 15-year-olds in 2 years,
Oh my.
right?
Yeah.
So right there, that's a serious event to
Hmm.
sit down and talk about, right?
Right.
So I think psych health and safety tackled the right way. I think we could have a better dialogue around it. It's just where do you start that dialogue, right? In the workplace.
Well, it's tough in the workplace. You have this, thing about confidentiality, and you have people who would say, well, they're bringing their home life with them. Well, that's just them. Like, so it's that sort of flawed worker theory
Yeah.
of, well, you know what, that person came with all that baggage, and they probably weren't coping well with life, and then we hired them. Sucks to be us. We hired them. You could have, that kind of callous attitude that really it's not about the work, it's about the person. And we know that the public consciousness is definitely rising on, burnout, and is really a problem of work demands not being managed, that work demands have overwhelmed management. So we're kind of maybe leaving the blame the worker, philosophy, but to get serious about how do we connect the dots with work. Like you use the example of, well, Joe hurt his back. Let's do a root cause analysis of why did he hurt his back? Well, he was lifting a heavy part that was stored behind some other stuff. And if we had good housekeeping and we could approach everything clearly, that's great.
Yeah.
Um, but what if we were able to talk about and say, well, Joe's been off work, and it appears like job stress was really a part of it.
Yeah.
Should we ferret out here and see where the job stress came from? Like, would that approach work? Is that the kind of thing that you would react and consider doing?
I think it's a possibility. It's just a matter of coming up with the tools to help people to do that, right? Like I know we're going through business transformation right now, and part of that's looking at technology, process, and people, like the roles that people are in, right? And so inevitably, when you're going through transformation, there's going to be change. And so to your point, how can we proactively look at, the jobs today? and what to look like in the future, and maybe involve the workers somehow in understanding the job demands and what's changing, and then maybe create a future state job that is better in terms of the 13 psychosocial factors and reduces kind of the stress level. There's a tool that I picked up when I was on a trip to Australia there for the World Congress, and I'm going to give it a try as part of that, but I haven't tried it out yet. So
Which tool is that?
See here, I got it right in front of me. It's called the Psychological Hazard Work Design Tool. And it was developed by one of the universities there. I can't recall which one, but it takes you through an exercise. So I'd be happy to come back on the show and share my what I learned, but I haven't done it yet.
Well, and as some of our listeners will know, this podcast is sponsored by an organization called Flourish DX, which operates in Australia. And of course, in Australia, they've legalized the requirement to do a psychosocial risk assessment and for business units to pay attention to that. And this morning I was reviewing the New South Wales WorkSafe or Safe Work New West Wales. I think I messed it up, the title. Anyways, they're looking at work design as a psychosocial risk control measure, right?
Yeah.
And so if we're looking at trying to motivate people, we could wait for an incident to happen,
right.
Or if we're walking into a period of change, and change management is sort of woven throughout the Canadian National Standard. Change management is actually a recognized risk factor with the HSE in the UK. But if we go about change and we use participatory design, workers can have input into work and design it in a way that it's going to be more psychologically safe.
Yeah. So I'm going to give that tool a try. I'd love to come back on and share my insights, or if I have any at that time. But you raise a good point around involvement and engagement, and I would say the success that we're having with our fatalities and serious injury strategy follows those same lines of thought. Our first strategy we rolled out, it was a 2019 to 2021 strategy, and then we just rolled out a new 5-year strategy. And it really focuses in on kind of 3 top industries and kind of 7 common causes of serious injuries in the province. But what we're trying to do is form really small learning groups where you get a couple employers together and we work through some structured problem solving based on the data. What are we seeing? Do a bit of root cause, and then involve the workers too in terms of designing what are some of those change ideas that we could try to try and tackle some of the root causes, but also based on research too. And a really good example of this, I've got 2 of them. We tackled firefighter cancer about 3 years ago, made tremendous improvements by bringing up some best practices from the state of Ohio and implementing those in fire halls here. And that involved leaders and workers. And then also, as it relates to psychological injuries, we had set a target to reduce some of the durations, because the durations of our psych injuries are quite high, probably double that of a physical injury. And so we had partnered with the Edmonton Police Service and helped some of our first responder organizations implement their program. It's called their reintegration program, kind of a peer-driven, approach to return to work that they've had really good success with. And we're already seeing a couple success stories related to that methodology here in the province. So it's bringing people together, man. Like, people want to share their ideas. Like you said, it's change management, but how do you facilitate that, right?
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
Right. So you've got participation from their leaders have obviously bought in to a certain degree. they're involving workers to be able to create some of the change management, to actually put feet to some of this vision and whatnot.
Yeah.
But when you're talking about the buy-in then of the leaders that these working groups represent, what do you think is the real key for them? Like you've talked about serious incidents, you've talked about cost. Like what drives these people to make safety such a priority?
At the leadership level?
Yeah, at the C-suite level, like at the, the owner of the business, the CEO, the head of human resources. Like what makes them buy in?
Well, it's got to be a value at that level.
Yeah.
It's got to be a value that's held by the organization. We value the safety and health of our employees and the environment, and it even goes beyond your organization. If you think about the supply chain that you operate in,
Hmm.
I think if you're looking at your product and you're developing it, you want it to be safe on site, but also beyond the fence of your organization. you
Hmm.
know so I think it starts with it being a value within the organization. um you know there's been lots of debates around incentives, but I think if you design them right, to get the right behaviors, those are other motivators for VPs and directors and kind of management level to do the right thing. Again, there's the business case piece like we've already discussed around the cost side, but
Hmm.
I think it, as an executive, if you don't, what's the word I'm looking for? If you don't hold it as a human value that you want to make sure everyone goes home safe at the end of the day, then I don't know. You're kind of working uphill from there, right? So
Right. Yeah. So you're working uphill. It's going to be a serious value, like a value that's held by the organization. And I think we've seen a big change here in Saskatchewan. There's many employers that I've visited over the years where, nothing moves until there's a field level hazard analysis. On the wall is so many days without a lost time injury. Lots of really, really important values around physical safety. Do
yeah,
you think we can extend that to psychological health and safety?
I think so. Definitely. Like in my mind, there's probably many different definitions to psychological injury, right? And I think the standard outlines one, and there's probably no right or wrong answer. I think my journey working through psych health and safety and building the resource center that we've built for employers here in the province, and working with Dr. Sammer, who's is part of the national standard here in Canada. I think it comes down to how we communicate and relate with each other. That'd be my simple definition of psych health and safety. I know there's other ones, right? Like
Hmm.
you're promoting wellness and preventing harm, that sort of thing. But if we learn how to communicate and relate with each other in a good way, I think that's going to build that trusted environment where people can really be open about safety in general.
Okay.
Um, Go
But
ahead.
how do they know about psychological health and safety? Like, I guess, like you talked earlier about taking from the theory to the practical.
Yeah,
Like, is there some sort of way that we need to link that so people see that how we communicate with each other, how we organize work, how we do all this does affect our psychological well-being? Because it certainly there's awareness of acute incidents like bullying,
yeah.
harassment, but the longer effects of work-related stress that would lead some people to burn out and just, sort of like this isn't working for me, I need to leave. Like how do we put those connections together for people? Because we know it in an academic sense.
Yeah,
There's folks of us who work in this field and we're like, yeah, we believe.
yeah,
But how do we get that message out, or how do we get people to buy in?
yeah. Well, it starts with the awareness piece first, right? That's the way we've tackled it. We built a psych health and safety resource center. Maybe we can put a link in the podcast if people want to check it out.
Yeah.
But we really wanted people to have a good understanding of those 13 psychosocial factors to start. And bearing in mind that we wanted it to work for small businesses, we have like short 2-minute videos on each one. We've got a couple practical tools on how this
Mhm.
could work in the workplace. We've got a small business tool. We got a return to work toolkit related to it. So trying to help people put it into practice. We've also got kind of a learning journey, kind of a continuum of where you could start and build your competency, whether you're a frontline supervisor, frontline worker or a C-suite or an HR person who's designing the whole psych health and safety system. And now we're piloting that 7-step roadmap where we're trying to help customers. And again, we started with 4 construction companies. We brought them together. And our goal was, let's teach them how to assess the psychosocial factors in the workplace and come up with an action plan. Just 2 steps.
Yep.
And we met quarterly as a group. And we also had an account manager that would meet one-on-one with them to help move them forward. And each company took a different kind of approach. We started with 4. Only 2 completed it. And I heard feedback from a couple of the customers where, it was a lot more work than I thought it would be. And we're like, yeah, it's not going to come easy. You can't shortcut this stuff, right? But there were some successes, right? They communicated with the staff, held kind of a large safety meeting to announce that, we want to put more effort into psychological wellness. Some of the feedback that some of the employers shared was, people kind of came kicking and screaming, like, is this going to be, a group hug session? No, it's not, it's not that.
In construction.
Right. Yeah. And then they did the Guarding Minds survey, identified kind of the hot spots and strengths and weaknesses. And it was interesting because I remember the one talking about how it brought forward kind of a bullying issue in their company, and they got a small company. It also brought some other insights forward around, the differences, the generational differences. So half the workforce is in young 20s, half the workforce is 60. One group is more open to talking about mental health. We're probably not surprised. It's the younger generation.
Yep.
But they've come up with some actionable insights. And one thing that they shared with me, which I thought was really neat, this year they've implemented, they're calling it a mental health check-in with every employee. And 2 questions: how are you doing? And how are we doing? And again, that's going to build their next objective. And that's how they're tackling it. So that's a small construction, blue collar kind of organization. And so we're learning from them too. And getting back to your original question, some of the feedback that we heard is they want us to link the 13 factors to a safety management system. So my prevention team is starting to work on that as well, to show the linkages on how the systems can work together.
So Kevin, what you're saying then is that these construction companies had a real interest. 2 of them dropped out. It was more work than they thought. The 2 that have stayed have really taken that idea of assess and develop an action plan.
Right.
Okay, so how far into the action phase are they? Have they just developed these plans? Are they well into them now?
They've just developed them, right? So, and this was our first pilot. So we wanted to try it with 4 companies, get some feedback. I shared kind of the feedback that they gave us. And our plan is to tweak the approach a bit. And then we'll be rolling this out more broadly, bringing more companies on board. So we should have more stories to tell in the future around here's a practical application of how they're trying to apply the standard.
Right. Now, not to incriminate anyone or cast aspersion on them, but were these 4 kind of people that had really lousy claims experiences, or were they 4 willing participants who are like, hey, we want to do something new and innovative?
They were willing. Yeah.
So these are people who are interested in psychological health and safety and said, what can we do? And you stepped alongside then with a process and said, let's give this a go. Let's see what we can learn, and we can be able to show to other people in our industry.
That's right.
Okay. So when we've talked about ideas of how to get people on board with psychological health and safety, we've talked about, well, it could be a critical incident. And I certainly know that worker suicide has driven a couple of organizations towards me working as a consultant. It certainly gets the attention of people. I've helped to treat some of WCB Saskatchewan's serious injuries. And when there is a serious injury, it does get the attention. On the flip side, they're like, hey, change is an opportunity to maybe do things differently, and we'd like to do things differently. And then in this case, they're like, well, let's try something different. You're saying, and we could model this for all your peers. And so awareness building, maybe that psychological health and safety doesn't have to be in the too hard bucket.
Right.
Yeah. Okay. And so when you've been dealing with traditional safety over the years, do people keep bringing up the ROI argument to say, well, what's the return on investment? Is safety worth it? Come on, like tell me that safety is really worth it. Like, did you have to deal with that very much, or would people more fall on the moral side to say, well, of course we're supposed to create a healthy and safe environment? Like, did you have to deal with the ROI conversation a lot?
Yeah, I would say it's 50-50. There's people on both sides of the coin, right? And there's different research out there, for every dollar you're going to get, say, $4 or $5 back. Um, but it's tough for people because they want to see it's hard to show what you've prevented, right? That's the challenge with
Yeah.
safety, right?
Hmm.
Um, and I think that's where, when you look traditionally at safety, people have defined that as the absence of harm. And I think what we're trying to change now is, no, let's measure the presence of safety.
Hmm.
So now you can have leading indicators that really are looking at what are you doing day to day to create the safety culture that you want?
Hmm.
Measure that, right?
Right.
The outcomes will come, right?
Right.
Um, but yeah, it's a challenge for sure.
Yeah. Okay. Well, because we started out the podcast, the discussion talking about once in every 10 days, a worker in Saskatchewan dies on the job. A horrible statistic. And then you said, well, and what that's twice as much as the US and 5 times as much as Europe?
Yeah.
Wow. So if we're looking at using statistics to perhaps be persuasive, an organization wants to look at a leading indicator, having work-related stress and having burnout and cardiovascular conditions that result from high job demands, long hours, right? That those are all really distal outcomes. They're long ways down the road. But if an organization was looking and saying, well, what proportion of our workforce right now is thriving and saying that they are really engaged and have high energy for work, that would be a total different paradigm shift.
Yeah, for sure. Yeah. We've tested out some like perception surveys and things and trying to go at measuring culture that way and trying to help people be more proactive, and it's been successful too. Um, but yeah, it's still a bit of a paradigm shift that we're going through for sure, Ian.
Yeah. So you said you have some early successes at the first responder group and reintegration.
Yeah.
And I know that on the serious injury strategy, one of the things that makes an injury serious is the fact that someone is off work for a long time and has a difficult time returning to work. So from your perspective, what does psychological health and safety have to do with that speed of helping someone return to work?
Yeah, this is an interesting one for us. This is part of our business transformation journey too. Like we're going through a bit of a service culture transformation as it relates to return to work. Because like our role really is to help facilitate good return to work, right? We
Hmm.
are the insurance provider.
Yeah.
Um, and I think, and I don't know if this is true of all parts of the world, but I think certainly here in Canada and maybe North America, it's kind of still that medically managed approach to return to work, right? And we sit back and we're like, we can't get those darn restrictions or abilities from the doctor, and the person stays off because of that, right? And days turn into weeks and weeks turn into months. And I think we've got to change that approach and take more of a supportive and kind of humanistic approach to preventing work disability, you know. And there's many factors, I think, that impact the outcome of a time loss, right?
Hmm.
And maybe some of those determinants aren't related to the incident at all. It could be relationship with the supervisor and coworkers. It could be personal factors at home. It could be other things, right? And I think trying to dig into meeting the customer where they're at, helping move them forward and work on some of those potential barriers. Um, and maybe changing or tweaking the mechanics a bit of return to work in terms of roles. I think that's something we could look at.
Right. So you're talking from the claims management side of things. How do you relate to a customer, meet them where they're at
Yeah,
to help them? But for an employer then who's like, well, we want to get this person back to work as quickly as possible. What should we do? What
yeah.
would you advise them about psychological health and safety in that context then?
Well, there's a lot of research out there. The employer's response to return to work matters. It truly does.
Yeah.
You'll have up to like a 50% quicker return to work based on how you respond to it. And so, again, that takes some planning, developing that return to work or stay at work program. What's your approach? How are you onboarding staff so that they know that our approach at our company here, if you're injured, whether it's at work or at home, is we want to accommodate you in the workplace. We want you to be here. We want you to stay connected. It's healthy to stay at work and recover. Even being proactive to the standpoint, I know you helped me with this when I worked in retail, but we dug into really understanding our injuries, and we had lots of shoulder injuries and back injuries, and they were our most severe and long-term claims. So we built that job jar, right? Let's really understand the physical demands of our roles. If a person had a shoulder injury or a back injury, what is the off-the-shelf return to work modified plan we could give a person? And it's probably 95% of the way there. And getting the person to ideally stay at work and recover. But so in the future, what we would like to get towards is a collaborative approach, working with the injured worker and the employer, co-developing that return to work modified duties plan. And the worker takes that to the healthcare physician, and we're more asking or changing the dialogue a bit around, is this safe versus I need the restrictions? And you may not have, as a healthcare provider, you might not have the tools to objectively assess the physical demands. You may not understand the full job demands of the role, because let's face it, there's thousands of different roles out there, right? So I think maybe we've put healthcare providers in a bad spot traditionally around return to work, or they might feel caught in the middle. So getting back to the employer being prepared, understanding their business, having a good stay at work plan, and supporting their workers. And so I think the key to making this work, though, at the employer level is the direct supervisor having really good communication skills or more emotional intelligence. And I think there's some good classes out there just to, how do we have good dialogue? We all weren't born managers, and sometimes we're just the best mechanic on the floor becomes the service manager, right?
That's right.
And so I know I'm giving you a long answer, but I think there's some things in there.
Well, this podcast is built on long answers because psychological health and safety is not necessarily easy and clear cut. But if I were to sort of trace backwards, what you're saying is that you could help people return to work sooner with a supportive manager who is willing to create modified work and talk about modified work. And even before someone gets injured or ill, saying that, you know what, guys, we care for you. We've got a modified work program. So if you're needing help and assistance, come and talk to us. We'll work at this. And so you create that supportive environment. It's very resource rich. So if we're looking at this, the lens of the national standard of psychological health and safety in Canada, clear leadership and expectations, right? Jobs that are physically safe, jobs that people have the competencies for. So spelling off some of those factors is going to create a quicker return to work.
Right.
Now, I remember the project that we worked on together. We were looking to prevent shoulder and back injuries. And in the retail environment, you took a very simple job hazard control. Shoulder injuries are made worse by shoulder level lifting. So in all the storerooms, there was a piece of tape that was set at 42 inches high, and it said no stacking of cases beyond this or something.
Yeah, it was actually called the 4x60 rule. So everything had to be at least 4 inches off the ground, and the top of the case couldn't be above 60 inches.
Yeah.
And again, there was a lot of work to make that happen, though.
Yeah.
That we had to talk to all of our suppliers, because again, it's cheaper for the suppliers to stack higher case loads, right, on a pallet, right? Lower transportation costs. But again, we had to fit the work to the worker. And we had probably 80% female worker environment, right? So we had to ensure that we're building the lifting situations to be safe for female stature, right? So, very simple. Like you said, low cost, no cost, right? That's an example.
No cost, but a lot of effort to get there.
Yes.
And so a lot of commitment then from, I'm guessing, your senior leadership at that time who are willing to go to the store managers and who are willing to go to the suppliers and the distribution centers to say, everything's going to be, we're going to cut down our pallet sizes here. It's going to come into the store like this. So real commitment through there.
Yeah, that's a perfect example of true commitment. Yeah, there's some
Yeah.
hard conversations going around. Yeah.
So what if I came into a workplace as a psychosocial job hazard inspector or looking for hazards, and we identified that long working hours were a hazard, and that staff expressed that mandatory overtime was a hazard. Could a business adopt an approach to mandatory overtime if it was a hazard?
I think they probably could, but I think that's probably a big gap right now, right? I think we'd need some problem solving tools to work through that. Maybe this one I described here might be one that helps the thought process around that. But really, if you use structured problem solving, I think you can apply that to anything, right? Getting really clear on what your problem is, looking at some current state data, doing a bit of root cause analysis, then coming up with some countermeasures to deal with those root causes. To me, that's structured problem solving that works for any type of problem, right?
Right.
So,
Psychosocial or physical.
yeah, that's right.
Yeah. Okay. So really coming full circle then is I think what you're talking about is elements that we see reflected in other standards, right? Senior management commitment,
Yeah.
involve workers and people to help participate and identify what's going on. And then from there, structured problem solving, and then evaluate your problem solving to
Yeah,
see, did this work?
that's right.
Wow. Okay. So, when you look at the field of psychological health and safety, you've talked about it sort of being emerging as people are sort of getting on board with this and realizing more about it. Where do you see the future going then with psychological health and safety? Because it's one of your five factors that make up a serious injury. So, where do you see psychological health and safety in Saskatchewan going?
That's a good question. Again, we started with awareness. We built the resource center. Now we're going from awareness to action. So we've got this community of practice approach where we're trying to help customers assess their psychosocial issues and develop action plans. I think in the future, maybe it can get more into that proactive space that you talked about, like actually looking at work design.
Yeah.
And developing some tools around that. We've been playing around with some hazard identification tools as well that are really focused on high forms of energy. It's called the energy wheel. And, that's increased hazard identification by as much as 30% in some workplaces.
Okay. Wow.
So maybe a similar concept to really help frontline workers understand what psychosocial hazards look like in the workplace, right? Because you've got many different cultures coming together too, and different language barriers in some locations too, right? So that's where I like the energy wheel because it's based on visuals. What are the gravity hazards? What are the chemical hazards? And they're just icons, right?
Right.
So what would a psychosocial hazard look like to a
Well,
frontline worker, right?
I could see, right, like exposure to incivility. So coworkers or customers who are really mean.
Right.
And perhaps looking at people that have to hide their emotions and have to suppress them, like healthcare workers often do.
Yeah.
Long hours, right? So I really love what you're building. You're talking about, well, we're going from awareness, we're doing some pilot projects, and we're going to show some results from these pilot projects. And so the regulatory environment here in Saskatchewan does not require employers to look at psychosocial hazards in the same way that they might nuclear energy or seat belts or things like that. But in the absence of regulation, you're hoping to really raise the awareness and get somewhere then.
Yeah, that's right.
Yeah.
Yeah.
That's great. Well, it's been great talking to you today. I really appreciate that. And so the results of this first pilot with the construction group, are you going to publish that? Are you going to have a webinar about it? Are we going to hear more about it when it sort of wraps up?
Yeah, you'll hear more about it for sure. We're pretty transparent about our reporting. So every 6 months, we plan to do a report out against our fatality serious injury strategy, have some customer stories on what we've done. This community of practice would be one of those, right? Along with others, like we're working on transit violence and healthcare violence and other things, right? So through that process, we'll share more. I could definitely come back on the show at some point and maybe dig in a bit deeper around what we've learned as well. So,
I look forward to that then. I'll have you back.
yeah, sounds good.
All right, thanks so much. We'll share in the show notes, the links to the resource center. And if people wanted to get in touch with you to ask more questions and to maybe get some insight on what they can do in their sphere of influence, how would you like people to get in touch with you?
I'm happy to add in my contact information with that link as well.
Sounds great. We'll do that.
Yeah.
Well, thanks so much for joining us today, Kevin.
Okay, thank you so much, Ian.
Thank you.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.